Can you hear me on YouTube? YouTube followers, give us some likes. I don't know how to do this.
I just pop up on the screen, but I didn't.
Yeah, there's a little bit of lag. It's okay. We're gonna see our mistakes. Yep, it's working. Okay, it's working, Drew. Confirm. All right. Thank you for the support. It's never fun without a little bit of a hiccups that you can resolve. You're on YouTube now.
Okay.
Okay.
Oh, the slides are also on.
Yeah.
Share.
I've incorporated yours into mine.
And I can open a new tab if I want to go and open challenges.io.
I'm gonna open it for you. Yeah. It's all it's PG-13 content.
Yeah, maximum.
It's up to us.
Yeah, you guys can go for as long. Can everybody go on by 10 so I can set up our meeting? Have the floor to do whatever you want. I'm here for tech support.
Maybe another 5 minutes and then.
we actually.
Good morning, everyone. Thanks for coming to Sage, waking up so early. Now we'll try to not put you asleep again with this short presentation, around 30 minutes between me and Tomas. We wanted to share a little bit about benchmarks and challenges and why do we believe we should do more of those, especially in biotech or tech bio, like they call it in the Silicon Valley. So give it a few minutes for folks to take a seat and then I'll get started. I'm the president of Sage. I'm Luca. I should have a name tag. Yeah, I'm here to tell you a little bit about challenges today. And let's start with Sage. What is Sage? How many of you have heard of Sage before? Okay, because you had to get here, right? So that's how you know it. Okay, great. Our mission is to drive a new age of discovery through truly open science and radical collaboration. So we're trying to bring open and collaborative practices that are common in other fields like computer science and physics to biomedical sciences. And our vision is a world where there's no silos across biomedical sciences and everybody collaborates openly and understands each other's languages and we progress a lot faster. We are a organization, 501c3, so a nonprofit based here in Seattle, around 110 employees, scientists, engineers, and governance folks. Mostly, that's our workforce. And our motto is better science together. We really try to live and breathe that. Our dream is to do open science with closed data. It's not easy. It's easy to do open science with open data. The CERN in Europe has taught us a lot about that. When you have high energy physics kind of data sets, no confidential information, you can open it up to the world. Everybody analyzes them. Higgs boson is found. Other people confirm it. Everybody wins, right? It's also easy to do not open science with not open data, right? Like that's what most of bioscience is. Like the data is not open and everybody works on their little silos. And we kind of try to be in the middle. We try to enable large community, large access to data sets that might be sensitive and closed. And so you have to be very careful about how you do that. That's why we have so many people that do governance in-house that can really help understand, can you use this data for this reason, but not this other reason, because that's what the informed consent said, because that's what the data use agreement said. We work with a bunch of folks. We've been around since 2009. So I don't know, how many logos do you recognize here? Do you recognize at least one logo? Oh, okay. Okay, that's why it's Seattle Tech Week and not Biotech Week. Yeah, so these are folks that are doing projects in this open science with closed data space. So trying to give broad accessibility to data sets that might contain private and sensitive information. And yeah, we enable them. We enable them from a technology perspective. We enable them from an educational perspective. We enable them from just a staffing perspective. Our stack is composed of 3 pillars. At the center, you have synapse.org, which is a data sharing platform. And in fact, I hear a lot of folks going around yesterday at a pregame event that already know and use, and sometimes are unhappy with Synapse because it serves a lot of people. So there has to be someone that's unhappy that gives us, things to improve. We're one of the 9 NIH listed generalist repositories. So if you are an NIH researcher, you're collecting data funded by NIH, you have to share your data. This is now a mandate. of the agency. And if you don't have a specific repository for your own domain, then use a generalist repository. And in that case, there's only 9 of us out there. And we're one of the few that allows sensitive data to be stored, because we have this governance piece that really can do the switchboard between the contributors and the user. So that's synapse.org. You need data, go check it out. 20,000 data sets, 2 petabytes of data plus, mostly sequence data, but also anything, digital health, images, you name it. Okay. Unfortunately, that's not a great way of data doing data reuse. It's a good way of doing data sharing. Just like put your data out there, list it, and then people will come and they will request access and they will use it. That's the dream. If people don't find that data, they're not going to come and ask for access. They're not going to see it. They're not going to look like what it is. You're trying to get people to come to your restaurant. You have to show them a menu, right? And that's hard to do with closed data. And that's why we build portals on top of our data sets. And that's on the left-hand side. These are ways of navigating and exploring the data sets even before downloading. And then there's the thing that we'll be talking about today, which is challenges. What does challenges have to do with data? Well, challenges are a great way to give a data set a lot of visibility, a lot of reuse potential. These data sets becomes a benchmark data set. We'll see in a second what that means. And then lots of people come with their algorithm and try to solve a problem that's defined by a community on it. One example could be a data set is a set of mammography scans. And the problem you want to solve is detect if there's breast cancer there. And I claim my algorithm is better than yours. But how do we know that that's the case? So that's the second part of the presentation. Curious, what's the best LLM out there? This is not only going to be a show of hands. This is going to be a quantifiable exercise. Please take a picture at that QR code there and vote your favorite one. What's happening? Okay. I'll give you 2 minutes. I was promised that we'll update online. Okay, good. Let's get to 20 at least. Can we? 15 maybe? Got one more. Okay, you guys got it. Best at what? Right? What is the performance metrics that we're using to define what is best? And this is a serious business in LLM world these days. So best of what got 14 plus votes. You know, the exercise went as expected. If you try to answer best at what in LLM world today, you're brought to dashboards that look like this. This is OpenLLM dashboard on Hugging Face, which is a place where community of AI researchers get together and ranks open models, specifically this one, so open LLMs. But then you have, you know, the whole first part of the slide is about what are you ranking them on? Average score across math kind of questions, GPAs kind of standardized test. Are we testing them on translation? Are we testing them on poetry? Are we testing them on architecture choice? Are we testing them? Like there's a lot of way you can test an LLM on, and there are standardized benchmarks for each of these different ways. And also, what kind of LLM are you scoring them against? You know, you can have like small LLM with very few parameters, very big LLM, and that's why you have the sliders back in the bottom side. Well, long story short, benchmark has become such a serious business in the AI world, that when a new model is released, this is Llama 3.1, so last week, the day before it's released, the way it's leaks and people already tell you, they're already writing benchmark. They already tell you how it compares to all the other ones. Like all over the internet, there are people writing spreadsheets and say, oh, it's better on math as compared to Llama 3, but it's not better than GPT-4 as compared to translation. And it's all about how better or worse it is in all different dimensions. And most of the time, this actually comes from the people that write the model. Meta came up with their own model card that scores Llama 3.1 across all these benchmarks that are out there. And if you don't do that, people will drag you to the arena. And I mean it. That's a chatbot arena. That's a service that online, if you log as a user, you're presented with two windows. There's two LLMs you don't know about, behind them. And then you choose a task. It could be math, or it could be you want to have a discussion about, translation. And then you interact with both of them. And then at the end, you vote which one was the better one, right? You don't know who they are. And that's kind of like a game between the two LLMs. The one that wins gets a vote. And then they're all scored against each other like you would do in chess. In fact, they use ELO rating to rank the best one, okay? So if you have an LLM, you put it out there, for some whatever reason, you don't provide benchmark yourself, you will be dragged into the arena, right? Like you will be immediately compared with everybody else to understand which is better, which is worse, in what domains, okay? When the goal is so clear, progress is fast. On the left-hand side is a tweet of someone saying, wow, Llama 3.1 is destroying Mistral that was published 3 months ago, right? Like doing twice as better in most of the data, the benchmark, GSM-8K, LSWOG, they have funny names like that. HumanEvol is a benchmark where you have to generate code based on doc strings. So I give you a natural language description of code. The LLM has to generate the code for that, and then it's evaluated. And so, Mistral, 50%, Llama 3, 76%. If you go and look at how we've gotten better as, society, as humanity, in terms of like HumanEvol specifically, that's the right-hand side of the graph. You can find that on Papers with Code. We went from 25% in 2 years ago to, close to 100% today. So that is a really hard problem. Like these are interview questions that you will get if you try to join Google or Meta or like any software engineering company. That's the kind of stuff we're talking about. And we're doing okay. It's not perfect. A lot of people are questioning benchmarks that we have today, and that's also healthy, right? Benchmarks become old and obsolete as people try to optimize for that specific metrics. Then you have to do new ones. But it's much better than not having a clue, which is what happens a little bit in health and bio. So why do you see that kind of speed? Why do you see that kind of progress in AI and computer science at large, in my opinion? For a reason that is eloquently elaborated, in my opinion, by David Donahoe, who's super famous statistician of Stanford. He's done everything in his life from studying compressed sensing to do pure math to more recently look at machine learning and really the social implication of this. And he says we are reaching a point of frictionless reproducibility in data science, which means that anybody can build on anybody else's work very quickly. Okay, that's why you have such quick progress. And what is that enabled by? 3 things, in his opinion, in my opinion as well. Data is open, easily accessible. Okay, you go to Hugging Face, data set is there, one-liner, you load it, one-liner, you train your model. 2, re-execution is easy, meaning code is available, either through direct running or through direct API access. But you don't have to do, you don't have to talk to people to get access to the code base. It's there, right? And then 3, challenges. There is a benchmark that is agreed by the community, and it's true for everyone, and everybody looks up to that on how we're doing. When those 3 things are true, you're approaching frictionless reproducibility, which I think is what we're seeing in AI these days, in non-health and bio AI, that is. Because when I lean into a little bit of my split personality of AI researcher going to NeurIPS and KDD and AI conferences, and president of Sage and running a health and bio organization and one of the largest databases out there, I usually run into this vignette, right? Like researchers, AI researchers, like super duper good people come to me and say, I know a lot of AI, I'm so motivated, I would love to work in health, I want to apply my skills to health. but there is no data out there. And I'm like, have you looked at Synapse? Have you looked at All of Us Workbench? Have you looked at UK Biobank? Have you looked at Biodata Catalyst? And the answer is no, 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 right? Like those are collectively probably, close to 50 petabytes of data out there that we could, leverage and build benchmarks on. And their answer is like our dose on Hugging Face, right? Like our dose on Hugging Face, because that's where you go look for frictionless data, frictionless code, and leaderboard, okay? So the data is there in health and bio. It's just not easily accessible. It does not allow frictionless reproducibility. That's why progress is so slow. And that's starting us. And this is research from me and collaborators. On the left-hand side, we compared machine learning for health papers and code with other domains, such as computer vision and NLP, so more mature machine learning domain. And when you have stuff on the upper bisector of the different dimension we use, technical replicability, statistical replicability, and conceptual replicability, then it means that others are better. And you can see that pretty much in any case, NLP and computer vision have better replicability across all these dimensions. So again, in machine learning for health, the code is not there, the data is not there, the metrics are not clear as a consequence. And right-hand side, I feel like it's even a more upsetting example. This is from Lancet Digital of last year with a few collaborators from Vector Institute and MIT. If you ask yourself, how well can we detect COVID from your wearable data? The answer will span from pretty much no better than random to 90% accuracy, right? Like these are different papers with data sets that are not available, code that is mostly not available, right? And if you just like take a peek at the description of the data set, because again, the data is not available. Some of those have a number of COVID patients in their data sets that is below what is US prevalence, widely below. That's a logarithmic scale, by the way. Some of those have number of COVID patients that is like 2 orders of magnitudes what you have in COVID prevalence. So it means like the data set is highly enriched for COVID. So they're solving completely different problems. Like one, you have people at the hospital that are coughing and about to die from COVID. Easy to detect that with a wearable, right? Like you just have to, basically see if there's a pulse. And then the other kind is like people that have COVID and no symptoms. Hard problem to solve, right? So are we 50% AUC or are we 99% AUC with detecting COVID? We don't know because we don't have benchmarks. Right. So enter benchmarks and challenges a stage. That's one of the things we do. So if you live in a field where you feel like there are questions that are very important, but we don't have good answer to that, or we have a lot of people bringing algorithms, but we don't have a common center of reference to compare those, then we can help. So the way a challenge is organized, and I will tell you in a second a way we don't have to be involved. Like we really want everyone to be empowered to do this on their own. But if you need help, we're here. The way this is organized are you pose a question, you find a reference data set, you engage solvers, like you need to have a community of people that want to share their solution and compete with each other. And we have a very large one that we leverage at Sage with more than 30,000 people, and it comes from the great legacy that Dream has enabled us to use. Dream is dialogue for reverse engineering of assessments and methods. Yeah, and it's the people that had wrote the first Dream paper back in 2013 really had a very long view on how this should become important in health and bio as well. So you engage solvers, then you have some infrastructure that can evaluate and compare models, and then you share results. If you work at Kaggle, if you've done Kaggle competition, how many of you have done Kaggle competition? 3, 4, 5. Yeah, that's a similar idea. Those are data science competition. The difference is that most of the time you don't have to be so focused on a scientific question, right? Like those are questions that are more easily derived from the data set. It could be like optimize a recommendation system. While in health and bio, you really have to be careful about the science behind the question that you pose. 1 and 2, the data usually is not sensitive. And so this is a big point of why it's hard to do challenges in our world because sometimes you can't even release the data set to participants because it's sensitive. But we have a solution for that. A lot of other people do. So stay with me. You can do open science with closed data. You can. It's not impossible. It's hard, but not impossible. This is just to say it's quite complex and involved as a from someone, you might come to me, Andrew, and say, I have a challenge. I'm trying to understand what is the best algorithm to fold proteins. That happened, and we know what it is. And then we'll talk about that success story in a second. But then, you'll come to me and we're like, well, what do you mean by folding, right? Like what kind of proteins? Like, do you have a data sets? Like, is it all proteins or, only the human ones? And folding, how do we score? What do we achieve? The perfect folding, and how do we score? How far we are from the perfect folding? Then when the scientific question is figured out, you assemble a team, you get the data. That's usually the hardest part. If there's like if the question is around EHR data, very hard, because you have to work with a health system and have them be okay, you using their data to run this challenge. And I'll tell you in a second how you can do that. Anyway, and then, I'm not going to go through all the boxes, but it's a social, technical, scientific, legal issue to run a challenge. It's not easy, unfortunately, not yet. We would really love it to be. It's not yet. And this is a little bit too much for 9 a.m. in the morning. So if you have coffee, take a sip for it, because we're going to go through this diagram here. But I think it's really important sometimes to understand the details. And this is the only slides where there's going to be details. How can you do open science with closed data? You're BSing me, Luca. That's not possible, right? Like, that should be the reaction. And the answer is, well, no, it is possible with a technique that's called federated benchmarking that we didn't invent, like some other folks came up with, and we have our own implementation. You can find a lot of other folks out there using it. But the idea is that you want to do a challenge on a reference data set, but that data set cannot be given to participants to train their model and compare them on a leaderboard. So what do? Well, you create some synthetic replica of your data set that is not sensitive anymore. And that's a whole ordeal, right? In how you do that and proving. And hopefully retains what's called high utility, which means it's similar to the original data set. Okay. Then you give that out to participants. They start doing model development on that, and they feel like, oh, okay, cool. I have a good model now to predict breast cancer from mammography, from synthetic mammography data. Now let's hand that model back to Sage. Sage will take it, will retrain it on the real data on a closed enclave. This is the right-hand side. The right-hand side on the orange is Sage-only infrastructure that's not accessible by participant, and then test it on a holdout set. Okay. But so there is a retraining step, which is A, could be very expensive if you have a large model, and B, it's probably gonna lose some performance because you're training synthetic data is gonna be retrained on data that is not exactly the synthetic data you train on, but it might lose some performance. But it works. Like, we've done it in a few challenges. Precision FDA, which is another challenge platform, has done in a few challenges, and it does give very good results. And the people that are coming at the top of the leaderboards, the score that they get on the leaderboards is very close to the score that we'll get on the synthetic data itself. So I don't think this is a generalizable method yet, because how you generate synthetic data depends on whether you have a good generative model for that kind of data. So we do have that for EHR. We do have that for nodes because it's text. Do we have that for sequences? No, not yet, right? Like, the best DNA models are still falling pretty short from mimicking a real DNA. But as we start having better generative models for different domain, for different verticals, you can start running challenges. Again, open communities, closed data, by creating synthetic replica. Okay, and now some example, and then I'll hand it over to Tomas. What is a challenge? Like, what are the questions that are being asked in health and bio? You might ask. One is the one example I gave you before. You give him mammograms, detect breast cancer. Best algorithms win. And in this particular case, it win big. It win $1 million. There was a prize at the top of this challenge, which made it super popular, as you can guess. And I'll tell you a little bit about the consequences of that, the good consequences of that. But we ran challenges to detect tuberculosis from voice recording. We run challenges to detect long COVID from EHR and wearable data. We predict mortality from EHR data and predict preterm birth from microbiome. Like really, like for LLMs, pick a task, pick a reference data set, get algorithms to compare, and tell the world who's the winner. And again, it doesn't have to be Sage. You can go to challenges.synapse.org today and try to run your own challenge. These guys here, the biomarkers of aging challenge, is run on Synapse. I had no idea it was. I just met the guy who's running it a few weeks ago, and it's like, oh, we're running a challenge with you. I'm like, no, you're not. It's like, yes, we are. Like, look, it's on Synapse. And I'm like, okay, it's working. So it's complicated again because it's a social, technical, legal problem because sensitive data, open community, and all that. But if you have all those social, technical, legal skills and scientific skills, you can do it yourself. And in fact, you're encouraged. And this is up there for free. Okay. Again, some success stories is challenges only there to, move the field ahead and do frictionless reproducibility in health and bio and, gets cure for cancer to our society, just that or something else as well. No, there's actually individual incentives that could be big. Again, in the digital mammography challenge, there was $1 million prize. Turns out that 2 of the top 3 people that won that challenge 6 years later got FDA clearance on that algorithm. Okay, correlation is not causation, but my speculation is that maybe in the submission there was some mention of the fact that the algorithm is being validated in the wild through a challenge. And then you can have like the other orthogonal and beautiful consequence of challenges. You have people that don't know anything about the science. Like you open it up to different communities, computational community, people with different science background. And in this particular case, 3rd place, high school students, okay? High school student, like where else high school students can wrestle and grapple with science problem, right? Like this is to me is an incredible education opportunity, like to open up the importance of this question to a community that's bigger than the one that generates the data, okay? All right, so are you ready? Are you ready to accept the challenge? So if you want to organize a challenge, what do you need? Well, you need data. You need a question or just an idea of a question that we can help you refine it. And you need funding because that large graph, social, technical, legal problem, it costs some money. If you are a participant, what are you getting out of it? Well, you're getting a lot of other folks benchmarking your solution. So you actually know if you say you're good and you just say it, or you actually are. You get to see data, right? A lot of participants, a lot of time are like, they are looking for data, like, the Vignette NeurIPS that I had, and you give them the chance to see some data set that's actually really well curated for that specific task. It helps them to grow and, educate people from all walks of life, including even high school. And it creates trust and credibility around a specific task and community. Like we understand what good looks like for a specific question, which is incredibly important for the field. I'm going to conclude by hoping I come from the AI community. I've seen what ImageNet has done for deep learning. ImageNet is a competition where you have to create an algorithm that classifies images and say, hey, this is a cat, this is a dog, this is a bird. And there was a lot of mess in the field up until 15 years ago, until Fei-Fei Li and others came around and said, let's create a great reference data set. We call that ImageNet. Okay, and then some of her students actually came and said, let's run a competition around this reference data set now. And that's where on the right-hand side, you see at some point, 2012, the error rate on classification dropped majestically. And that's where the first CNN algorithm was introduced. So convolutional neural network, which is the gold standard right now in computer vision. And from there, the rest of the story, right? It all started from this. We have something like that in health and bio, right? Like you probably heard the success story of AlphaFold, best algorithm out there to predict protein folding. It also came out from a competition. It's called CASP. And that's the leaderboard, right? Like that's to see everybody else and then AlphaFold. When you see this kind of like quantum leap you know we're onto something as society. I would love to see a lot of those quantum leaps for a lot of the tasks that we have in health and bio. With that said, I want to give a shout out to the folks that are involved in running and building challenges at Sage. I put images up for some of those, but there are more than 6. And also a shout out, we are hiring a director for this team. So if you're interested in this position, please apply. That's the QR code, or just go to Sage by Necklace /careers. With that, I'll leave it over to Thomas, which is the guy bottom left, who's going to show you a little bit of demo and another public service that we're running.
Thank you, Luca. So hi, my name is Thomas Schafter. I'm a solution architect working at Sage. And yeah, the challenge ecosystem is really fragmented. And so here, for example, we have identified more than 25 organizations that leverage health data that organize these challenges. But let's say you are a participant, you want to, you have some time, you want to contribute to the challenges that this organization make available, then you need to go to many different websites, and that takes time. So yeah, more than 25 organizations here really focusing on the ones that leverage health data, like mammogram images, genomic data. But the issue is that there is a lack of standardization. So for example, what an organization may call a task, another organization may call it a sub-challenge. So there's different terminologies. There is no central hub where you could go as a participant and search for a challenge. And yeah, searches are really time consuming. And then on the other end, so you have the challenge organizer. And what you want to do is really maximize the visibility of your challenge. Not only advertise your challenge on your own website, where only the people who know about it are going to look for it. So we developed a tool called Open Challenges, and it's available on openchallenges.io. And our approach was first to look at the challenges that these 25 plus organizations are running, and then come up with a standard terminology, vocabulary. And then we collect the data from these different websites, we map them to this common open challenges schema, and then we make this data available in an application, which is a web application running on openchallenges.io.
You want to show that?
Oh, yes, please. And finally, we work with the communities to make sure that their data looks good in openchallenges.io. So here you have our app, again, really focusing for now on the challenges that leverage health data. We currently have more than 500 challenges registered, organized by more than 400 organizations. And these challenges are organized. They come from 15 different platforms. So that's where you would go as a participant, register, download the data, read the docs, submit your tool, and then access the leaderboard. Here, we always like to show every day 3 different challenges, the challenges of the day, picked randomly from our database. If you know about a challenge that's not registered yet, you can let us know, and then it will appear in Open Challenges. And yeah, here again, some organization we are featuring, and here are the different platforms where these challenges are organized. So you see Synapse, which is the platform developed by Sage, but you also see Kaggle, Nightingale, and more. And just quickly, you can search organizations, you can search challenges. So here, for example, if we are only interested in challenges about cancer, bam, here very quickly, you get these challenges. So there are currently more than 100. And then you can filter by type of incentives. So let's say you're interested in monetary incentives, or you're interested in the opportunity to publish a scientific paper. Then you can select here. Yeah, access the challenges that are currently active, or that will become active soon, or challenges that are complete. You can also filter by category, whether the challenge is a hackathon, so maybe just organize in like a couple of days. If the challenge is going to start soon, close soon. You can filter by different. different 15 platforms you saw before, and so on. So yeah. So here is a open challenges. So here is a QR code. If you scan it, you will only see the challenges that are currently upcoming or active. So that represent more than 100 challenges, I think actually 111. So plenty of opportunity if you want to contribute to one of these challenge and help science. And we also have a Discord server where you can join us and chat, ask questions about challenges. And with that, I want to thank you for being here today.
Thanks for sitting through this. I guess we can take some questions and after that continue our breakfast and networking until 10. I see Kate until 10. Yeah, so we have 45 more minutes to chat. So question about a presentation, or we'll go back to the room and continue get coffee. Yeah. Mm-hmm. I will repeat the question. Okay. Yeah. Yeah, I will repeat the question. So the question is, you said you introduced yourself as a non-technical person. You're interested to see where this is going to go, and what is the impact on healthcare? And it is also going to use, and you're asking also if it's going to use data from the UK, international sets. Okay, so one thing to start is what Tomas just showed. OpenChallenges.io is a register of all people that are running challenges. Now, the challenge itself, depending on which one we pick, are the one that are going to move the field forward. Okay, and which one are those? I don't know. In fact, there is a big push in the field to get some sort of like list of open problem that the field could agree on and we should focus on, like kind of like 23 problems of Hilbert, as you know, David Hilbert, if for those of you who have a background in math, did at the beginning of 1900, and hyper focus the community to focus on those 23 and not the other one. So I think that's a great question, and the community needs to come around at that. I feel like today what I'm seeing the most developed are benchmarking and challenges, either very early on the biology side of things to all the way to protein, so where you can stay away from human subject issues. So AlphaFold is a great example. Like this, just basically it's a physics problem, right? It's only about protein, how they fold. I feel like as you get closer to sequences in DNA, that you start getting into re-identifiability constraint, and then these challenges become harder to do. On the healthcare side, I'm seeing a lot of activation there too. There is now a group called CHAI. You know about them, right? That wants to build an assurance lab that are basically evaluation and certification authorities, for lack of a better word. They're not going to be authorities like the FDA is, but like they're going to be someone that will look up to say if certain models in healthcare are good or not. So they will be validating models such as, for example, sepsis prediction based on ICU data. So it's like in clinic, healthcare focus, patient facing models, I feel like will be the first one that will go through this benchmarking revolution, if you want to call it that way. What about international data sets? Well, that's another layer of complication, right? Like if you're trying to work with data sets in Europe, you have to deal with GDPR, and then the legal bubble that you see in that graph becomes the biggest one of the whole process there. So this is not to say that it shouldn't be done. In fact, we should invest in doing some more of that. But I feel like most of the solution I've seen so far, that's not only Sage, are US centric. Because as you, again, move towards re-identifiability risk, the approach between US and EU is very different. Yeah, and it's easier here. For now. Yeah. So that's the thing, actually, I didn't touch on almost at all. Like what happens at the end of a challenge, right? So in the Kaggle competition setting, usually, you get a gold star. Like you go to Reddit and say, hey, I won this competition. You become a guru. You go get to Google and you hire for $500,000 a year, right? And in the bio world, sometimes there's money, like we saw earlier, but most of the time the reward is really bringing the community of solvers together post challenges. So what we do is the scientific work that we do at the beginning to frame the question, we keep it going all towards the challenge. And at the end, we re-engage, let's say, the top 10 and ask them to share the model for non-commercial setting, non-commercial use, and ask them to come together and write a paper together about the learnings. Like what are the models that won? What if we do an ensemble of the top 10? Does it get better than the first one? So I can send you, and I should have it on my list, I can send you paper, even like highly ranked and cited papers that come out of challenges because of that scientific exercise you do at the end of a challenge of bringing the community back together to see what do we learn. If you go to, yeah, Tomas.
I can answer. So yeah, most of the challenge, I would say the challenges that we organize. So there is a leaderboard table, and directly from the leaderboard table, you can click on download or the URL to download the container with Docker. So it's a requirement that we said that if you want to be eligible for the incentives, whether it's the monetary, the cash price, or the opportunity to be invited to the conference to present your tool must be open sourced and be available after the challenge. So that's a requirement we set.
Oh, I have to repeat the question. Sorry, keep me honest on this, because otherwise people on YouTube will not hear. One more question. Actually, I'll give you the microphone. Easier.
Hey, my name is John, and I'm curious, what are the computational or data center costs for the participants, both in terms of the folks entering into the competition, as well as the folks on the other side of the blinded data that's then doing the scoring?
That's a great question, and mostly, unfortunately, an unsolved problem. So here is where health and bio being behind hits the good way, in the sense that people are not using large capacity models that much yet. They're not using LLM that much yet, though we're thinking about running a challenge on them. And so the cost of training, usually it's at most in the $100 by participants that we absorb as an organization. In fact, it goes in the cost of paying for a challenge. We've been experimenting in other models where the participant pay, but that really decreases accessibility, obviously. And we don't have a good solution for high capacity model that might take, hundreds of thousands of dollars to even just retrain. Like the federated benchmarking I showed earlier, like you have to retrain the model inside the cloud. That's, for a LLM, that's just impossible to do, right? So, you all have an idea on how to do that at a low price, low cost? Come talk to me. Unsolved problem. Do you want to add something, Tomas, to that? No? Okay. One more question.
Great. Thank you for the presentation, and really love the collaborative approach that you're trying to drive. One question I just had was, especially when you're looking at end solutions that might result in an FDA-approved product or drug, how does the patents and or proprietary information fall into these challenges? That
is a fantastic question, and one that we get a lot. here, I think we have to go a little bit on the details to understand how to do open science with closed data. Again, it's and here the closed applies not to sensitiveness, but much more to proprietariness of the solution, and not necessarily of the data, but of the algorithm that are being created. Okay, and I think we have to be nuanced to understand how to to walk this line that's in between two extremes, completely closed or completely open. Like one thing that we do, and other folks that independently have used Synapse to run their challenges are doing, is that your model needs to be made source available. So technically, it's not open source by OSI definition, because OSI definition of open source is that it's source available, so everyone can see and download the code, but also it's unrestricted use. You can do anything with that. Okay, that's the real OG definition of open source. If you take just a small step below that, where the code is available, readable by everyone, but can only be used for research setting, so a non-commercial license, right? A lot of people still call that open source. It is technically incorrect if you really want to put your pundit hat on. But let's say this, you can read it, you can use it. Then you have your cake and you can eat it too, because you have the scientific reproducibility that's still enabled, right? Like everyone can take the model, modify it, republish, do whatever. But if you try to build a product, or if you're trying to use it for an asset, or you're trying to do any commercial downstream, you have to come back and license it with the participant. So it can even become a marketing engine in some ways, right? Like a way of giving a visibility to your model. Now, is this a perfect system? No, not necessarily, because this model could be put in the cloud behind closed door, and good luck proving that it was the original one that the participants submitted. So you have to settle that in a court of law. But it's a good deterrent, and I think it's the best we can do so far to kind of have the best of both worlds. Yeah, I mean, depending on how hungry you are, right? Maybe a couple more questions, maybe. Yeah, listen.
Yeah. So one thing that I'm always thinking of with the biomedical challenges specifically is once you start opening it up and trying to get as many people as possible participating, you can really introduce a lot of bias, both in the data itself and in the question being asked, right? So like the biomarkers of aging, I think one of the best biomarkers of, like not having cognitive decline as you get older is to be relatively wealthy. So what are some tools or resources that we can provide to people to try to prevent that type of bias, or at least make it more known and explicit as we set up challenges and run them and evaluate them?
I think that's a wonderful point, and a point that's much more advanced in the AI community right now, because they've been doing this for a longer time. And so, for example, for LLM, you don't have a single benchmark, right? Like you have 20, and all of those are like continuously rediscussed and challenged and changed, and like there's a whole community-driven process to decide what is the right benchmark, which in some way should counter the bias you're talking about, or at least smooth it in a community setting. So in health and bio, we don't have that community-driven effort yet. I think it could be spearheaded by playbooks. By what? Okay, there is a shout out to Chiron Toolkit, which is a toolkit in the sense of like a set of documents and policies. It's not a toolkit in the software sense, but it's a playbook to understand how you can actually answer the question that Abby was saying, like how do you bring community together in an unbiased way and make them aware of the bias they might have. And it can be applying to the data sets, and it could be applying to the solutions that are being submitted. So go to if you go to our blog post on Synapse, there is a whole series on what's called Chiron, CHIRON, which is this toolkit to do community-driven engagement around problems like the one we discussed. Thanks for the call out.
I'm going to piggyback on her question because I've never heard of this challenge before. So being that it's not like advertised heavily on social media, how do you ensure that a diverse group of people are taking the challenge to get a diverse set of data points in the first place if it's not readily available to the general public?
I didn't get your point. Are you saying we should make sure, or are we making sure already?
How are you making sure that a variety of people will take this type of challenge?
It's hard. I think in our case, our community, the Dream community, first of all, is an international community, which is not, it's not US based only. And I think that's already great. And then I don't know if I have a map of where the participants come from, but it's not just the global north. So at least we have some diversity in geography and some diversity in education. I don't think I have the map there. But again, yeah, a lot of these participants, we don't get to meet in person. So we don't, you know, we really are sometimes not able to, you know, try to bring other community in. Although I highly recommend, if you ever join a challenge, when you join the community-driven tools that surround the challenge, which usually is the Discord channel, that's where you can bring on the community you think are missing. Like, these are open exercise, right? Like, so if you feel like there is someone missing, you have a chance of bringing them in. We're doing some of that work, but it's never perfect, as you know. Let's say one last question, then we go back to croissants. Yeah.
Is there any like demographic data collected on the type of participants for challenges like this?
We on Synapse personally don't. Some of just location, right? And probably some anecdotal based on the top 10 participant, the one we engage with at the end to write a paper, because, you know, then we meet and greet them, we invite them at conference and stuff. So I think we might have a good idea of those, but not a large. I think some of that is by choice, right? Like not wanting to, you know, burden the participant with too much information. I think you should check the other 25 or 24 platforms that are out there. I think is a good question, and I think, yeah, we should be aware of who's participating, rather, you know, beyond the dimension of high school, not high school, or Italy, not Italy. Yeah, thanks for the feedback there. Okay, yeah, well, send us off, Chris.
One of the things I noticed about your sponsor group is that it was largely nonprofit entities. And one of the challenges we were discussing last night is bringing commercial entities into the fold of sponsoring competitions like this. Even in the face of the type of synthetic data generation, transit, closed environment type of protections, the mandate that the sort of respondent algorithms be open source is likely problematic for, say, a venture-backed entity who's generated this data, worked to synthesize a representative data set and so on, in as much as they probably need to avoid creating competition for themselves in the marketplace. So how do you think about, you know, extending this into a places where a lot of the really foundational data for biology, you know, companies like InCitro or more recently Xera are going to be generating these really impactful data sets, and yet we want to gain access? How do you bridge that gap?
Thanks for the question. That's you know, something that keeps me up at night. Well, first of all, we have to pick our battles. And as Sage, we're a nonprofit that's trying to bring collaborative practice to biomedicine. So we are always going to nudge, you know, in the open science source, anything direction. I think that for there's 2 points there that you're making. Like, one is around the data and one is around the model. I think the data could really be very protected, right? Like in the federated benchmarking setting that I was showing earlier, like participants never see the data. They see a synthetic replica of it. And I think you can build that replica with a lot of guarantees for the people that are data contributors to, you know, your IP is not going to be stolen. Your participants are not going to be identified. And by the way, you're going to learn, because that's the interest of the data contributors, that most of the time is also the challenge organizer. You're going to learn in a non-competitive way if the task that you really care about is even solvable, right? Like this is like one way of looking at it is you're getting labor for quite cheap, engaging all these communities. So there is a direct benefit for folks that are interested and they have like a question that they might not want to spin out the data science team internally, but they want to see first, let's let it loose in the community and see how well the community does. Oh, AUC 0.5, let's not care about that, right? So I hope there's the incentives piece that also transpires on the data side. On the model side of things, I think we run challenges where we request the model to be open. You can run your challenge as well, right? Synapse is out there. You can run your challenge where you don't require models to be open, and that maybe gets in more industry in submitting the models, and I think that's perfectly fine, right? Like as long as there is more benchmarking in the field, I feel we all win. So that will be my answer. Thanks, Chris, for the question. For any other, you have another question? No, yeah, you're clapping. Okay, great. All right. For any other question, we can, have a chat today near the breakfast piece. And again, thanks again for coming, and welcome to Tech Week. Well, let me stop the stream and then.